In this video, I'm going to talk about the mechanism of paradoxical emboli, where due to the presence of blood clots in systemic circulation, patients will develop ischemic strokes. So first, I would like to talk about the normal physiology of fetal circulation. So since the lungs are not inflated in fetus, there is no point for the entire blood to pass through the lungs. So there is two ways that blood will be shunted away from the right side of the heart to the left side. And one of them is foramen ovale, which shunts blood from the right atrium to the left atrium, and then the second one would be ductus arteriosus, which shunts blood away from the pulmonary artery to the aorta. Now, after the child is born, lungs will be inflated, and thus there would be less resistance in the pulmonary vessels, so blood will start to flow into the pulmonary arteries, and thus more blood will return to the left side of the heart. So because there would be increased pressure on the left side of the heart, there would be pressure on these septums to close on each other, and thus septum primum and septum secundum will fuse on each other and causes closure of the foramen ovale. At the same time, contraction of the smooth muscles causes closure of ductus arteriosus. So this is the normal physiology of the heart, and if there is a blood clot in systemic circulation, such as DVT, it would travel to the right side of the heart, and then from the right ventricle it goes to the pulmonary artery and causes pulmonary embolism. Now, in individuals that have patent foramen ovale or atrial septal defect, there would be shunting of the blood clot from the right side of the heart, from the right atrium to the left atrium, and from here it would go to the left ventricle and directly travel to the brain, as a result of which it will cause a ischemic stroke. And that's the reason that this condition is referred to as paradoxical emboli. It's because instead of causing a pulmonary emboli, systemic blood clot leads to the development of a ischemic stroke.